everyone, today I'm going to be explaining how to do the microbiology stool test. This one is quite a straightforward test. There's just a few things to avoid beforehand. So if you are taking any antibiotics or antifungal medications, you just need to finish the course of that and then wait for 3 days before starting to take this test. If you're taking any digestive enzymes or antacids or aspirin, you also need to stop that for 2 days before doing the test. And if you're taking any probiotics, those need to be stopped for 7 days before you start this test. And then when you're ready to do it, it's quite easy. What you do is you will collect your stool sample into this little container, and then you're going to transfer some of that stool into your little vial. So there's some gloves in your bag that you can use, and you'll see that your vial has a little red preservation liquid. You want to leave that liquid in the vial, and then you just need to collect enough stool so that everything reaches up to the red fill line. So you only need a small amount of stool, but try and collect from different sites in your collection container, not just the one site. There is a scoop attached to the lid of the vial that can be used to transport the stool into the vial. And then once you've got it up to the fill line, you just close it really tightly, shake it really vigorously so it's well mixed with the liquid, and then put your name, date of birth, and date of collection on the little label as well. Then you put it back in your Ziploc bag and put it in the refrigerator until you're able to bring it back to us for shipping to the lab. You do want to bring it back to us as soon as possible after collection so that we can ship it off to the lab for you. And if you have any other questions, feel free to give us a call or an email. Thank you.